Hi, good afternoon, ma'am. I'm Julie Vifelino Concepcion, a fourth-year nursing student of Abra Valley Colleges. Today, I'm going to demonstrate donning and doffing of PPE, or personal protective equipment. As a student nurse and for nurses, we play a vital role in preventing transmission of infection. Most infection control measures are independent nursing activities. We do not need an order for them. We do need theoretical knowledge in medical and surgical aseptic techniques. Personal protective equipment, or what we call the PPE, refers to protective clothing, goggles, or face shields or other garments or equipments designed to protect that wearer's body from injury or infection. PPE is a specialized clothing or equipment worn by nurses or employees for protection against health effects and safety hazards. It is designed to protect many parts that includes the eyes, head, face, and hands. The purpose of PPE is to reduce the risk of transmission of microorganisms to patient, also to reduce and prevent the risk of cross-infection, to prevent contamination of sterile field, to prevent dispersal of droplet from wearer to environment and patient, and also to enhance easy handling of sterile equipments. Here are the equipments needed. We have here the gown, the surgical mask or the N95 respirator, the face shield, and the surgical gloves. Before we proceed to the procedure, perform hand hygiene. Now, we proceed to the procedure. In donning or putting on personal protective equipment, the first thing we do is to put on the gown. And make sure it is tied securely at the back. Next is put on the surgical mask or the N95 respirator. Then make sure it is securely tied at crown and nape of the neck. Once it covers the nose, make sure it is extended to cover your mouth and chin. Then put on the eye protection, which is the goggles or if none, the face shield, if there is a risk of splashing. Lastly, put on the non-sterile nitrite gloves. And now, ready to enter the patient area. Now, we do doffing or taking off PPE. When removing the PPE, you will be doing this inside the patient care area. However, if you wear a respirator, the respirator will remove the once you leave the patient care area. First, remove the gloves. Do not touch the outside of the gloves because they are considered contaminated. To remove the gloves, grasp the outside of the cuff of the glove and peel off. Holding the glove in the gloved hand, insert the finger underneath and peel off the second glove. And then dispose the gloves. Next thing we do is to remove the gown. Avoid touching the front of the gown and sleeves. Carefully untie or break ties of the gown. Peel off the gown by removing the hands from the inserts and then move the shoulders and arms up through the gown, which helps allow the gown slide off the body. Then from inside, with the assistance of the arms, roll the gown away from the body by turning it inside out. And then form it into a ball and discard. And perform hand hygiene using alcohol or soap and water. Once outside the patient care area, you have to remove the face shield. Remove the face shield by carefully grasping and lifting back band of the face shield over the head, and then dispose the face shield. And lastly, remove the surgical mask or the respirator N95. Grasp the bottom strap of the mask and lift it over the head, and then grasp the top strap of the mask and lift it over the head. Then discard. Then perform hand hygiene. Thank you for watching.